speaking now as well. Are we good? Okay. Good evening. Thank you for coming. My name is Ellis Hospital. I also serve on the board of directors of NYSNA. We really appreciate you all coming to this town hall tonight for a very, very important discussion. Our first speaker is going to be Christine Walters. She's an RN from Bellevue.
Thank you. Thank you for being here tonight. And more importantly, thank you for caring about women's health care in the Capital Region. My name is Christine Walters. I've been a nurse at Bellevue Women's Center for the past 15 years. 13 years as a mother, baby, and postpartum nurse, and in the last 2 years in the role of a lactation nurse. This gives me the rare opportunity to get to see all of the patients in all the different departments, both as a NYSNA executive committee member and as a lactation nurse, because I make my rounds on all the different departments. A few months ago, we heard of Ellis's plans to close surgical services at Bellevue, apart from C-sections. They planned to lay off 14 nurses and provide a minimal plan to train the remaining nurses at Bellevue to take on the new responsibilities that would be required of them. I will use a quote that my husband learned from his high school art teacher, and we still use this today for ourselves and our children. Proper prior planning prevents putrid projects. Proper prior planning prevents putrid projects. We at Bellevue and Ellis are in the middle of a putrid project without proper prior planning. Ellis made these decisions without any input from the nurses or the larger community. While Ellis announced that they would make these cuts at the end of December, they recently shared that they will now happen as of August 22nd. That's a little bit more than a week away. So they did so without announcing anything to the broader public. We should all have concerns about what changes like these mean for the future of women's care in our district. While women will still be able to have C-sections at Bellevue, patients requiring any other type of surgical services related to women's health will now be required to have these procedures at Ellis on Knott Street, not to mention all of the other surgeries that we once did at Bellevue. They have slowly but surely eliminated the procedures we used to perform at our facility. Ellis's main campus is already chronically understaffed, and this plan, or lack of a plan, requires services to be shifted to an already overworked staff. Our concerns are not new. Ellis has a history of making major changes to beds and staffing without including the input of the nurses. We've lived through this. When one unit closes and plans of care shift, it affects every other unit, especially at a smaller, specialized hospital like Bellevue Women's Center. There is a snowball effect that happens. It's important to point out that these changes go well beyond Ellis. Over the last decade, Trinity Healthcare, an out-of-state, for-profit healthcare corporation, has gradually acquired all the hospitals under St. Peter's Healthcare Partners and has tried to consolidate hospitals and healthcare institutions in our region. Our relationship to Trinity is no longer a management agreement, as we were originally told. It is a full-on merger. They have a history of attacking women's health care services in the region, and in 2023, they attempted to close the Burdett Birth Center at Samaritan Hospital, and they failed, thanks to the overwhelming support of the community, area nurses, NYSNA, and politicians. These decisions are largely made by people sitting in offices in Michigan who are completely disconnected from our reality here in Schenectady. At Bellevue, we are concerned that if we do not speak out now as these changes are underway, we may eventually face the same fate. We are all here tonight because Ellis needs to invest in its nurses, this local community, and put patient care over corporate profits. Thank you. I will say, as a last thing, and I'll say this with emotion, I had my children at Bellevue. Because of the care that I received there, at 40 years old, I decided to become a nurse. And at 45, I reached that goal, and I became a nurse at Bellevue. The care that I received there I had a loss between my 2 pregnancies. I was cared for by the PACU. I was cared for by ambulatory surgery. I was cared for by lactation. It's why I'm a lactation nurse. Thank you, Patty Jacobson. I was cared for by upper level mother-baby nursery. My experience at Bellevue was exemplary, and it's why I work there today. Please, let's protect what we do at Bellevue. Please, let's not let corporations take over what we do. Thank you so much.
Thank you, Christine. And next up, I'd like to introduce Catherine Mitchell from March of Dimes.
Is this good enough? Do you want me to? Is that better? Okay. Thank you, Christine, for your words. Good evening. Thank you to Save Our Services, New York State Nurses Association, and the Save Burdett Coalition for hosting this important town hall meeting. My name is Catherine Mitchell, and I'm the National Director of Maternal and Child Health and Collective Impact at March of Dimes. But more importantly, I call the Capital Region my home. I am here tonight to voice my concern about the proposed removal of surgical services from Bellevue Women's Center. While I understand that labor and delivery services would remain for now, this decision raises urgent questions. Is this just the first step? Will we be back here in a year or two fighting to keep the rest of these essential services available? At March of Dimes, we know exactly where this path can lead. The loss of specific maternal health services, such as the close of obstetric units or loss of service lines, is often an early warning sign of broader hospital shutdowns or reduced access to care. Our 2024 Nowhere to Go Maternity Care Deserts report found that in just 2021 and 2022, more than 100 hospitals, about 1 in 25, closed completely or lost their obstetric units. As a result, over half of U.S. counties no longer have a hospital with obstetric care, leaving 5.3 million women and birthing individuals of reproductive age with limited to no access to care. The report further showed that in 2024, more than 1/3 of U.S. counties were considered maternity care deserts, meaning they have no hospital or birth center offering obstetric services and no providers such as OBGYNs, midwives, or family physicians who deliver babies. We've all seen the headlines. We know the statistics. We live in one of the richest nations in the world with one of the most progressive states in the country, yet birthing individuals are facing staggering maternal mortality and morbidity. We should be looking at opportunities to bolster our maternity care system instead of dismantling it piece by piece. The loss of surgical services at Bellevue alone will not create a maternity care desert. Labor and delivery services will remain for now, but every service reduction places additional strain on that system. The proposed transfer of surgical services risks compounding that strain, making it even harder for patients and providers to access and deliver comprehensive care. So we must ask, what is the plan to safely transport patients between sites? How has this been communicated to local providers, midwives, doulas, and perinatal support professionals in the community? Are we prepared for the added pressure on the already overworked and understaffed systems at Ellis and Bellevue? And what are the plans to ensure that Bellevue's business model remains viable without surgical options? These are not small logistical details. Strains on our ambulatory system, delays in care, and overburdened staff all increase the risk of poor maternal and infant health outcomes. I recognize that hospitals are under intense financial pressure and that leadership is working to balance budgets. But efficiency cannot come at the cost of safety, dignity, and equitable access to care. We made it through the pandemic and we're supposed to be building back better. Instead, we're fighting simply to hold on to the precious services we already have. Not long ago, we came together as a community to protect the Burdett Birth Center. That was a victory because people spoke up locally and at the state level with one united voice. Now we face another moment that demands that same unity. I envision a New York where you live does not determine your ability to access quality care. a state where greater access to perinatal and obstetric care providers is available. We can make that a reality, but only if we act now. I urge Ellis Medicine to slow this process down, commit to full transparency and clear plans for next steps, working hand in hand with community leaders, providers, and public health experts to ensure decisions are guided by the needs of the community. I also urge all of you to press the governor to support policies that protect communities losing essential health care without a voice in the process, like the Local Input in Community Healthcare Act, which would require public notice, meaningful engagement, and stronger state review before any hospital or critical service line could close. Families already have enough challenges. Accessing the care they need should not be one of them. Let's stand together to make sure Bellevue's Women's Center continues to serve as a trusted, full-service hub for women's health. We cannot afford to lose one more piece of our maternal health care system. We deserve better, and our families deserve better. Thank you.
Yeah. Thank you, Catherine. And before I acknowledge our elected officials here, I do want to say a few words that a lot of the public does not know. I retired in January of this year. Prior to that, the Ellis operating room went down to one functioning OR after 7 p.m. And oftentimes, I keep in touch with my colleagues, oftentimes they are working till 2, 3, 4 a.m., one room at a time. If they're in the room doing a case, doing an emergent case, and a woman shows up to the ER with a ruptured ectopic pregnancy, I want you to think about that, because she will be in deep, deep trouble. Those happen fast, and they are often deadly. So that's just something I wanted to throw out there so people know it. So the officials I would like to acknowledge are County Legislator Richard Dussault, Michelle Osterlich, Ray Ishmael, City Council President Marion, I'm sorry, I can't read your name. Thank you. City Council Member Demoni Farley and Carl Williams. Also to speak later on will be Phil Steck. Thank you. Falling down on the job. Sorry about that. Next up via Zoom is Sivan Rosenthal, a NYSNA Research Department.
I want to just, first of all, apologize because there's a really crazy thunderstorm happening where I am, so if you hear any loud bangs, don't be alarmed. It's just really loud thunder. So I'm going to talk a little bit about some of the sort of systemic and corporate structural changes that lead hospitals to make decisions like closing surgical services. And just go through some of how that looks in the capital region. So I'm just going to start with this graphic that is a graphic of sort of corporate consolidation as it's happened in hospitals and healthcare systems in the capital region over the last like 20, 25 years-ish. So you can see there's a bunch of different colors happening here. They're all representative of different healthcare systems. All those like mint teal colored hospitals started off as independent hospitals in 2000. And then we have a couple other health systems like Northeast Health System, Seton Health System. And when you go over to the 2024 side of the graph, that's basically where we're at now with 3 healthcare systems, 2 of which are planning to merge. So you've got LVMed up at the top, and then you have Ellis and St. Peter's, and the reason we're all here, part of the reason we're all here at least, is the planned merger between them that would create what is essentially kind of a duopoly system in the region. So I don't dwell too long on this graph, but this is just to give you a sense of sort of how movement has happened between the healthcare corporations over the past 25 years. And so part of the reason this happens is that healthcare systems try to move a lot of them into this hub and spoke model of healthcare. You have to the right here a graphic that should sort of illustrate that. And the idea behind the hub and spoke model is essentially that it reduces the quote unquote need for the same services at each spoke of the system. So you have sort of in the center a flagship hospital, for the purposes of St. Peter's Healthcare Partners, that would be St. Peter's Hospital. So if it's the Albany Med Health System, it would be Albany Medical Center. That's sort of the big acute care hospital that's in the center of the system. And then you have these system-affiliated spokes that, will provide less acute care and transfer in and out of this flagship hospital. And the idea is, you don't have to have acute care services or like very specialized services at every hospital, and you could have that at the flagship and just sort of transfer in between those. And obviously there are other hospitals, that are not in that system, and those are represented here as well. So you can sort of see how these all function in this healthcare ecosystem. So the idea behind this is, I know this has been mentioned tonight, efficiency. So an efficient, quote unquote, system can improve, as I said, provide acute services and then transfer in and out, and then you don't need to do everything. So in big healthcare corporations, sometimes the corporate structure can mimic that hub and spoke model. So instead of, patients being transferred between the spokes in the hub, money is also another thing that can be transferred in and out of the hub or in and out of the sort of central corporate, parent by the spokes in the model, or the smaller healthcare systems or even hospitals that it owns. So, St. Peter's Healthcare Partners is a health system that's owned by another health system, that being Trinity Health. So Trinity would be the parent of St. Peter's would be the parent of St. Peter's Hospital, St. Peter's Healthcare Partners would be the parent of St. Peter's Hospital, and so on. So this came up, when the proposal to close Burdett went through and the Attorney General was sort of investigating that. This is something that came up, this transfer of funds between the parent company and the hospitals in the system. And the Attorney General James, actually found that Samaritan had been transferring millions of dollars to St. Peter's Healthcare Partners and Trinity Health during their investigation of that planned closure. So I included here to the right sort of a snippet from, was not actually from the investigation, it was from a subsequent lawsuit that St. Peter's filed back against the AG. But that sentence that I highlighted, you can see over the 4 most recently reported years, which was fiscal year 2019 to fiscal year 2022, Samaritan made around $98.9 million in quote-unquote equity transfers to affiliates. And those affiliates, they say, are St. Peter's Health Partners and Trinity Healthcare, so sort of the other parents in that system. So Samaritan is the only Trinity hospital where this happens. If you go through other Trinity facilities throughout the country and you look at those that have closed services or closed even entire hospitals, you can sort of see this pattern emerge. So I just took 4 here as an example. We've got Johnson Memorial Hospital in Connecticut. They were acquired by Trinity in 2015. They, in 2022, announced that they were planning to close med-surg, ICU, labor and delivery, and a few other services. And between 2015 and 2019, using that same method that I referenced in the previous slide, you can see that they transferred $12.6 million to those affiliates. And just to clarify, the affiliates aren't exactly specified in the 990, but there is an outward transfer of funds, and just based on how the Attorney General did it, this is what we're assuming that money went to. So if you look at Mercy Hospital of Philadelphia, acquired in 2013, closed in 2020, $38.25 million in equity transfers between 2015 and 2019. Mercy Hospital Chicago was acquired in 2012, closed in 2020, and had $4.8 million in transfers. St. Francis Medical Center, that was in Trenton. It was acquired in 2013, it closed in 2022, and they had $19.2 million in equity transfers. And this is a sum of the equity transfers, just to clarify. And one other thing that I just want to highlight about this slide is that these last 3 hospitals also, they were in poor and predominantly Black neighborhoods of the cities that they were located in. And especially for, a nonprofit health system, and also, thinking about the impending Medicaid cuts, that's just something that I wanted to highlight in terms of who gets hit by these types of closures as well. And you can look further into these. There's been a lot written about every one of these closures, but I just wanted to point that out. So, closures, as I said, they can be entire hospitals. They can also be just units that don't make as much profit as other units in the hospital. Maternity often gets hit in this way because of that. Stephen Hanks, during the planned Burdett closure, Stephen Hanks, who's CEO of St. Peter's Health Partners, told the public that losses, and he means financial losses, incurred through the operation of the maternity services unit at Samaritan were behind the decision to close Burdett. And later, after there was a public forum, he said that at St. Peter's, with the expanded number of rooms available and the consolidation of our staff at one location, we're not anticipating capacity problems. So going back to that graphic, this is sort of the hub and spoke model at work. You can see from the language what the expectation for the model of care is. So from that AG investigation that I mentioned, the Attorney General, and the pattern of closures at Trinity Health, we can see that there are complicating factors, that these decisions aren't always made for the reasons that hospitals are publicly disclosing alone. So I just want to end by sort of making the point that Ellis is adopting this model before they've even joined St. Peter's Health Partners and subsequently Trinity Health. So the CEO, Paul Milton, Ellis CEO, said in May 2025 at a county legislature hearing that Ellis's financial position needs to improve in order for that merger with St. Peter's to go through. In that same hearing, he also said that Bellevue's primary issue is efficiency, according to Milton, volume is down at Bellevue, so that necessitated a move for services to the main campus that we're talking about tonight. So I think there's some questions that we should be asking about Ellis's apparent move towards this hub and spoke model and this efficiency model. The first one being, will forcing Bellevue patients who need surgical services to transfer from Bellevue to Ellis actually improve efficiency? Also, what will change for the community when Ellis's hub, after this merger goes through, is a religiously affiliated hospital? And at what point is the cost of the community higher than the financial cost for Ellis? So those are some things some questions I wanted to pose for us to think about. And I know some of these were mentioned by other speakers, but that's the end of the presentation. I'll be around for questions later. Thank you.
Thank you, Sivan. That was pretty informative. I really appreciate all that. Next up is Assemblyman Phil Steck. Thank you.
Thank you very much for inviting me to come and speak at this forum. This is an event put on by the New York State Nurses Association, so at first glance you'd think this is a labor issue. It is far more than that. This is about the future of healthcare in the United States. And what we've been merging hospitals and doing all kinds of things that are supposed to be more efficient. And guess what? Costs have gone up and very little has been accomplished. In fact, patient care has gone down. So we need to stand steadfastly to keep all the services at Bellevue. Now they talk about, it was very interesting to see the remarks from Mr. Hanks from St. Peter's, where he was talking about all the capacity they had at St. Peter's Hospital. Nonsense. In fact, the longest wait times in the ERs of any hospitals in the state of New York are not in the Bronx, they're not in Brooklyn, they're right here in the capital region. And that tells you that they don't have the capacity to serve all these patients. I know from stories of people who have been there that there are people waiting on gurneys out in the hallways because they don't have rooms for them. So make no mistake about it, healthcare in the United States has been declining steadily due to mergers and due to so-called efficiencies. Costs have been going up, care has been going down. So I'm very pleased that here in the 110th Assembly District, we do have an institution like Bellevue Women's Hospital that can provide care to expectant mothers and those who have given birth. We don't want to lose that. That is important to medical care for the community, and all the other stuff is just, well, it's BS. Thank you.
Thank you, Phil. Yes, all the other stuff is BS with a capital B. I'm a little annoyed because I'm an OR nurse here. So our closing remarks will come from Dawn Zip, an RN from Bellevue Women's Center.
For some people in the room, they actually recognize me. I've been at lobby days with Phil and Angela Santa Barbara's office. I have been to the county legislator. I have been to many events, including the Save Burdett, and spoke out at that as well. I have a big mouth, and I'm not afraid to share what's important to me and what's important to our community. I am a night shift nurse. I work in the NICU. I have the pleasure of taking care of a very vulnerable population here in Schenectady. I have amazing doctors. I have amazing nurses that I work alongside of. Mother, baby, and labor and delivery, amazing nurses and doctors to work alongside of. But now we're under attack. Surgical services being moved to main campus is been strategically put into place for quite a few years now. It's something that the community wasn't aware of, and we have slowly watched them basically bleed us to death over at Bellevue. They talk about numbers being down. Numbers are only down because they created the shift starting about 2 years ago. This is not something that just happened overnight. Yes, births are down, but births are down across the country, and births are not down as much as they are actually claiming that they are. It is kind of leveled off for the past 5 years, 6 years now, so there's nothing new under the sun with that. What has changed are these larger corporations coming in for profit and taking over smaller community hospitals and completely devastating a community. We are in a poor community, we are an underserved community, and we do an amazing job with what we do at Bellevue. I gave birth to my last child at Bellevue. My first two were born down on Long Island. I have to tell you, the care that I received at Bellevue was stellar, and I was at Stony Brook University Hospital with my first two. So I was at a level 4, and here I come to Bellevue, and I have to say, thank God I'm not doing it again, but if I had to do it again, that's where I would have done it. I've had family members that have delivered there. I've had friends that have delivered there. I have had coworkers deliver there. We do a phenomenal job, and I'm really concerned because the writing is on the wall. Michelle asked the question, I asked the question when we stood in front of this administration, good old Stephen over there from St. Peter's, about what are your plans? If you're planning to close Burdett, what can we expect over in Schenectady when you guys merge with us? Oh no, we're not going to do anything to you guys over there. Well, we're already seeing it happen. I work in the NICU. I can tell you within the past 6 months, equipment, as it breaks down because it gets used, is no longer being repaired. The quality of the supplies that we are getting now has decreased. They are buying cheaper supplies than what they had before. We have nurses that are now leaving in droves because we are not staffed appropriately, and as a nurse is leaving, they're not replacing nurses because they're saying we need to work more efficiently. What they want us to do is do more with a lot less, and nurses are burnt out. We have one nurse that calls out on one unit, and it literally sends 2 other units in a complete frenzy because they can't shift our care. I'm a NICU nurse. I'm not a labor and delivery nurse, and I'm not a mother-baby nurse. I'm not a lactation nurse. I'm a NICU nurse. And yet, if somebody calls out and we're so-called staffed halfway decent, they can pull me as a NICU nurse to go work on mother-baby and take care of a mom and a newborn. I'm taking care of no more than 3 patients in the NICU. I'm going out onto the floor and I'm getting 6 patients. I'm getting a 3-couplet assignment, and it's not easy. It really pulls you in a million different directions. The labor and delivery nurses, as they are losing nurses down in labor and delivery, they're not replacing them. So now they're calling us up. I was on vacation 2 weeks ago. I got 3 or 4 phone calls, texts, such and such is short today. Would you be able to come in and work? We're offering call pay, time and a half. Oh, no, wait, we're gonna offer a bonus shift because we are desperate. Nurses are not even saying yes to overtime shifts because we're so tired, we're so burnt out. You cannot keep cutting our staff, cannot keep cutting our services and think that we are going to operate in a safe manner and to be able to take care of this community. Surgical services is a huge hit to us, huge hit, because like that ectopic, you have a woman who comes, they don't know that we don't do those things at Bellevue anymore. We haven't done it for over a year. They still come to Bellevue. Even with a provider telling them, please don't go to Bellevue, go to main campus. They don't go to main campus. It is the reality of it. And what happens? Now we have to wait for an ambulance to come and pick them up. And many times that ambulance is sitting over at main campus waiting for a room or for their patient that's on their rig to get put through to the system, so that way they can come to Bellevue and pick up the patient that's at Bellevue, so that way they can go to main campus and get to sit there on the rig and wait for a room to be available. And now after our surgical services, because they wouldn't call in our OR nurses when they were there, now those are the patients that are struggling and are potentially their lives being put at risk. We have this administration saying, oh, don't worry. The only thing Bellevue is not going to do when we have this merger is we're not going to be doing terminations, abortions. That's the only change that's going to happen. Interesting. Because no sooner did he do that and say that to the community and to all of our leaders in the community and to the different groups, did we get the gauntlet saying the surgical services were going to be gone from Bellevue. Don't lie to our faces. Don't tell us that you're not going to do something and then you do it anyway. We're not stupid. We're aware. We're educated. We know what's going on. I want this community to know that the nurses at Bellevue, we do a great job. The doctors do a great job, and we will continue to do a great job, and we'll continue to stand and advocate for our community because our community is important to us. I don't want any woman to get turned away. I don't want them to feel like that they're not valued, that their health isn't important. And let me tell you, women come in sick today. They're not like the women years ago coming in to give birth. We have complicated patients. They're not what they used to be. We need to come together as a community and stand up against Trinity. I'm not even calling it St. Peter's anymore because St. Peter's isn't the St. Peter's that it used to be. Everybody used to tout St. Peter's is the place to go. Well, it's not the place to go anymore. It's Trinity, and Trinity is not the place to go because they don't care. They don't like to look bad in the public's eye, by the way, just so you know. They don't want to be questioned. Question them. Every single time you have the opportunity, question them. Ask them, what are your plans? Because you know what? They're not going to give you a plan because they don't have a plan. We're still waiting, in effect, bargaining to figure out how we're going to deal with the changes for surgical services closing. Oh, that's right, August 22nd. And we still don't have a plan. They don't know what to do. And as we bring up concerns, the nurses bring up the concerns and the issues that we see with this, they don't even have an answer on how to solve it. It's like we have to solve their problems for them. It is time for the community to stand up and say no to this whole debacle. There is a, speaking of speaking up, here's our opportunity. There's a petition. There's actually a QR code right here that you can scan. We have handouts. Take a picture of it, bring it to your neighbors, bring it to the people that you work with. Get the word out. Let's get this petition signed, as many signatures as we can, so that way we can let St. Peter's, Trinity, no. And I'm sorry, Ellis, because like a lovely woman over here said, she went to Ellis, and guess where her bill came from? Not Ellis, came from Trinity. If you look for Bellevue Women's Center as an Ellis hospital through insurance companies, guess what? It doesn't exist. It is a Trinity healthcare partner. It is a Trinity hospital. It is not an Ellis hospital. So when they sit across the table from me in management, which I get to speak to them every month, and they said, oh no, but we're not St. Peter's, we're not Trinity, no, we're Ellis. Really? Because I don't think they're signing your paycheck, Ellis. It's actually Trinity signing their paychecks. It is Ellis it is Trinity that is signing our doctors' paychecks, and it is Trinity who is bringing all of this down. They make billions of dollars. Keep that in mind. They're a billion-dollar making corporation. Thank you.
Thank you, Dawn. Before I open it up to question and answers, I just want to throw in another thing in line with what Dawn was talking about. There is no plan, and when nurses, there's lots of nurses here, when we tell you something bad is going to happen, you damn well better believe it. I've seen it way too many times. We tell administration something bad is going to happen, and invariably it does. So now I'd like to open it up to questions and answers. Or statements, yeah. Yeah, there's a mic. That's okay. We like big mouths. There's a mic.
As a Bellevue nurse who works in the surgical center, this is my 4th job loss with Ellis West. I've gone from St. Clair's to Ellis to the ambulatory surgery center on McClellan Street to this one. And now they're closing this one. When they closed St. Clair's and McClellan and started bringing some procedures to Bellevue, we were told we were going to get all the outpatient this, the outpatient that. We got diddly squat. So now, 5 years later, the same thing is happening over here. They're shutting it down. We're not getting, they've shut down the, what do you call that thing when they do the OR case setup? Whatever it's called.
Yeah.
On call?
I don't get involved in that.
Okay.
She's like, I do the pre-sub where the doctors have to put their times in and stuff.
Yeah.
And then a doctor will want to come and do surgery there, and they're saying, I'm sorry, oh, it's your block. I'm sorry, but it's not your block time. So we got a place to put people, we got nurses to care for them, but because it's not their block, they don't get to do the surgery. So what do? They go elsewhere. The whole system is nothing but a big screw up. That's all I have to say. And my last day is August 22nd.
Are you retiring?
I don't know yet, because they want me to stay for call to keep, I don't know about that.
Use the mic. Please, people, use the mics.
Can you get to it, okay? Can we cut the earbuds? Okay.
Trinity is is it on? Yes. Trinity is a Catholic organization, and as such, it approaches pregnancy and birth in a particular way. If there is a problem with the mother giving birth to a child, the mother is forgotten about and the child comes first. I know this firsthand because our daughter works in a Catholic hospital in Phoenix. This is a horror. One of the people who was just speaking talked about how pregnancies are becoming more complicated. This is true because women are choosing to give birth at later ages. We have more pregnancies around the age of 40. I read somewhere as a statistic, and so there are problems. Nobody knows when they are coming into a hospital, whether it's your first birth, your second, your third, whatever, what is going to be happening. The doctors don't know, you don't know, because every birth is individual. I had 2 children who came out breathing and happy. I had my 3rd child, I was breathing, he was not. I had that child at Bellevue and the care was wonderful. We have to do something because people in Niskayuna can get to Albany Med and there may be time to get to Albany Med, and maybe there won't be. We have a dividing line in Schenectady. It is called State Street. Those that live on one side in Niskayuna have cars and can get around easily and go to Albany Med or Saratoga or whatever. Those that live on the other side very often have no cars, rely on buses. There is a huge population of people from other countries who have come in. They live in public housing. They don't know, they have children, are giving birth to children. They don't know how to get around and how to use the system at all. It is an unfair thing. As Trinity has swallowed Ellis Hospital, we can only hope that with enough push from everybody, that it will then regurgitate Bellevue Hospital, so that Bellevue Hospital can stand alone and provide all the services that are needed. Thank you.
So first of all, I'll start off by saying that my wife is a registered nurse, and before she became a registered nurse, we also had some very difficult pregnancies where we've lost babies, and this is a long time ago, but it was the care, the informed care, the culturally responsive care that we received at Bellevue that helped arm us with the information we needed to know moving forward for us to have our two beautiful sons that we have now. I think that we need to be outraged at this. This is not something that we should be considering as something that's just unfortunate. This is a matter of life and death. So as we talk about the questions that we'll have for Trinity, what we really need to be talking about, what's the question that we have for one another? And the first one is, what are we willing to do to prevent this from happening? This is time that we start to prioritize healthcare rights over a revenue stream. When we think about what's happening in our federal government, if there was ever a time, the time is now. So again, I'm almost less concerned about what they're planning on doing, and we should be talking about what we're not going to let them do. Because again, this is a matter of life and death. And with that, I am small and committed, and I plan on introducing a resolution to Schenectady City Council in support to stand for Bellevue Women's Center and the people of the city of Schenectady.
My name is Joanne Seifel, and I'm not used to speaking to people like this, but every time I look at this problem, it becomes a bigger problem. And then I see even a bigger problem. I got a bill from Alice that said Trinity, and then I got a bill from the Eddie from one of my patients that said Trinity. And then I got a bill from St. Peter's, a surgical, saying Trinity. And so I started looking into this. And the problem is much, much bigger. What Trinity is able to do is because insurance companies are in a position to buy a health facility. They're not breaking the law. They may be doing something that is unethical to us. The problem is much bigger than that. And so I would like to present this question to our assembly people. What is going to be done about putting a bill on the floor to make sure that insurance companies, not just Trinity, which is a Catholic association, which is extremely dangerous for Bellevue Maternity and other women's hospitals throughout the country. But the bigger problem is that an insurance company could actually buy of the health facility. That's what we need to start. Yes, we need to do this, but we need to look at the bigger picture too. So my question goes out again to our assembly people. What is the plan?
Hi, my name is Catherine. I want to thank the opportunity for this town hall today, and I want to thank all of our elected officials who joined us. like many people here, received services at Bellevue that were very efficient. And I have a few questions that are both rhetorical and maybe answerable, I'm not sure. My husband was offered a job in Texas, and he declined that job because I wouldn't be able to receive the health care that I would need as a woman reliably in that state. And I'm beginning to wonder if people will start having that same conversation about moving here to Schenectady County, to moving to New York State. And so many people, and I'm just using people as a general word, I'm so, this is clearly about money for Trinity, and it's not about people, and it's not about communities. And when money is what motivates many people, it sounds like this could actually affect our economy in a measurable way. And Schenectady City specifically and the county is doing a lot to raise our tax revenue. And if people make decisions not to live here and use these services and pay taxes, then I think this has a reverberating effect through our community that people haven't really taken into account. And so I guess my question that may not be rhetorical is, how do we hit them where it seems to count? I don't want my healthcare premiums to go towards someone's yacht money. I want it to go to healthcare for people, my neighbors, the children in my community, and my friends. And I guess, yeah, how do we do that? I don't even know. So thank you.
Hello, everybody. My name is Marina Franchild, and I was part of Save Our Services for several years. And the reason I'm mentioning this is we did a lot of work to try to implement the changes that everybody is talking about. So I don't think it makes sense to reinvent the wheel. We've kind of been dormant lately. We went as far as we could go. We had very, very brilliant people who knew a lot about the healthcare industry trying to help us. They knew how to navigate it. They knew who to reach in government. We got as far as the Attorney General. We tried to have a bill passed about transparency so that if a merger is proposed, that an impact on the community would be taken into account. There's a lot of work that's already been done. Why am I saying all this? Because I don't know a lot of people that are here today, which is great, because you're new people I can meet and work with. We all need to plan, figure out how to strategize. That's what's needed right now. We all know what the issues are. We all know how upset we are. There's a lot of emotionalism, which is appropriate, but that's not going to help us. What we need to do is kind of have a think tank, get together, have a meeting, and Michelle, maybe you would be willing to like walk people at some point, through, because you're very, very good at this, you're a very good speaker, through what's already been done. And we need to pick up with where we stopped and figure out where to go from here rather than trying to reinvent the wheel. So I think that people should try to reach out, meet each other, and plan another meeting that's a strategy meeting, that's strategic, and that is geared toward coming up with a solution, not geared toward talking about how horrible it is. We all know it's horrible. It's time for political action. Thank you.
We do have time for only one more question. Thank you.
I did not come here tonight to speak. I've had two daughters, both at Bellevue. First daughter, I lost. She was incompatible with life. The day before my birthday, I went to find out whether I was going to have a boy or a girl, and I found out there was no amniotic fluid, and she was incompatible with life. And we received exceptional care at Bellevue. And then I was lucky enough to get pregnant and have a wild ride of a pregnancy with my second daughter, and a wild delivery and an emergency C-section, which what if they take that away? What do they expect you to do? Pack up and take your birthing ball and your meditation tapes and drive somewhere else? I can't imagine that. But when I drove here, I was thinking about my daughter, who could potentially have a child someday, and she would not receive the care I was able to receive. That is inconceivable to me. We have technology, we have medical advances, and women's health care is falling farther and farther behind. We should be ashamed of ourselves in Schenectady County that we are allowing our young women to receive worse and worse care. We need to take care of our women, and we need to do better.
Medical services, we're also losing physicians.
Excuse me.
Leaving the county, they're going to other facilities. So we lose some good doctors because of this too.
Excuse me, I want my sister's question answered against what the politicians or our assembly people are going to do. Is there anything you guys are doing right now or to address this? Make sure Trinity doesn't get more monopolized and so on and so forth. Is there anything going on? Are you guys doing anything? Please answer my question, my sister's question. No? Another answer?
Let me take the podium.
Sure. Go
ahead.
So, okay. Problem solved. There are many solutions out there to this problem. I'm a strong supporter of the New York Health Act, which would do away with the private health insurance system, period. So that would address these problems, but you don't have majority support for it. You have 150 members of the New York State Assembly, not to mention the Senate, so you need to get the support of the majority. One thing that we looked at with respect to Ellis is that Ellis could become a public hospital. There are many public hospitals in the state, some in rural areas, and that would give the community control over the hospital. But again, in this world in which we live in today, the first thing you do is you say you want a public hospital and someone will yell, socialism. And then people, you have difficulty getting the majority support for that. Also with the public hospital, you would have to have some stream of public funding, which would require the county probably to have a role in funding it as a public hospital. With respect to mergers and acquisitions, generally in New York, that's an antitrust issue which goes through the Attorney General's office. I can't remember in the 12 years I've been there of any antitrust legislation even being taken up. But that's not to say it shouldn't be. It's just not on the agenda now. I have my legislative director here with me, Dylan McCoy. You're happy to reach out to him as well. I don't know if there was a bill you told me to sign on to.
It was the Joanne Simon bill, I think.
What does it? Oh, it's the is it the closure, requiring public input into closure? Yeah. Okay. So we signed on to that, but that's not going to come up, if at all, until after the first of the year. We're not in session again until after the first of the year. And it seems like you have some insight into that legislation and you think there's obstacles to it? Is that what you were saying?
Yeah, right now it's the governor.
Yes. So our governor, though a member of my party, is very corporate. And for example, when it came to safe staffing, which was legislation we passed, the governor never took the steps to implement it because it has to be implemented through the Department of Health, which the governor controls. So the promise of the safe staffing legislation did not get fulfilled. This governor, whenever some corporate entity complains to her, she runs in the other direction. Okay, we always say, what are our legislators going to do? I say, also, what are the people going to do? The people have to support these changes. They have to support things like single-payer health insurance, and when someone yells socialism, they have to say, we're not going to be fooled by that. We've got to move in a new direction because the healthcare system is failing. So It's a joint effort for sure, but I can give you, this is on topic a little bit and a little off topic, but it is healthcare related. There was a bill to allow, it was called Dignity in Death, or the Dignity in Death legislation, which allowed people who were seriously terminally ill and in pain to have a process for ending their lives. This took forever to get it passed. You had the Catholic Church lobbying against it because people aren't allowed to make decisions. Only God is allowed to make a decision. And of course, my personal conversations with the Lord have been lacking in recent years. But in any event, my point is that, so there was that kind of opposition, but the bill did pass finally, and now it's on the desk of the governor for signature. But I think the Simon bill on hospital closures is something that if there was a group that really organized for it and put pressure on the legislature. And with that, let me say this. We're very lucky. The New York State Nurses Association is an outstanding labor union that fights not only for the wages and benefits of its members, but they also fight for better health care policy. They are a big influence in the state of New York, but they also need to get all the other labor unions to join with them, which doesn't always happen. So these are some of the obstacles we face. What I like to see, if I were governor, and if you give me $30 million, I'll start my campaign tomorrow. But if I were governor, we'd be moving down the road to single-payer health insurance because the insurance companies accomplish nothing in this system. Thank you.
I hate to cut us all short, but we are actually on a timeline, believe it or not, with Schenectady County Community College. Petition. The petition is for us as a community to stand up together as a group against the powers of St. Peter's. We're going to voice our opinion as a huge community, and to go that way, it unifies us. It allows us to work towards a common goal together, and that is something I think we need to do here in Schenectady. I don't care what neighborhood you're from. I'm from the city of Schenectady. I live in the city. I am a patient in this city. I'm a worker in this city, and I am proud to be in this city. So I think that that's what we need to stand on, okay? And the other thing is just get this petition out. And we appreciate every single one of you guys for coming. If we do another town hall, which I'm sure that we will, we'll give you updates and some planning, and we'll definitely go there with you guys. Thank you so much for coming, and all those that came to speak with us.